How you will manage any kind of tachycardia in emergency situation? Let's know about it. Whenever you notice any pulse rate goes above 150, you can consider it as a tachycardia. Now, first you have to check with ABC assessment, monitor if IVX is taken or not, and then 12-lead ECG. Once you're done with that part, first we have to differentiate if tachycardia is stable or not. Remember, yes, stable doesn't mean it's normal. Stable means currently it is not causing any end organ damage. Now to differentiate, you have to check with 5 things: hypotension, altered mental status, shock, any chest comfort, or pulmonary edema. If you notice any of one sign out of this, you can consider it as an unstable tachycardia. According to SELS protocol, if you notice any unstable tachycardia, you should directly start cardioversion. But yes, in India, they generally don't do cardioversion. They directly give any antiarrhythmic drugs, even though it is unstable. Okay, but actually, as a current SELS protocol, you should go with cardioversion. Now, if you don't notice any of these 5 symptoms, means it is a stable tachycardia, but still it's a risky one because your pulse rate is currently 150 above, right? Now, to understand the treatment, you have to divide tachycardia into 2 types: narrow complex and wide complex based on QRS complex. Now, there are further division as regular and irregular based on the RR constants. If RR is constant, it is regular. If RR is not constant, it is irregular. Okay. Now, if you notice narrow, regular tachycardia, means generally it will be a SVT or arterial flutter. How will you manage this? Generally we treat them with maneuvers, or you can go with adenosine 6 mg. If it doesn't work, go with 12 mg, then 12 mg. If still doesn't work, you can go with beta blockers and calcium channels blockers. And even after all this, if it's still tachycardia doesn't settle, you can go with cardioversion. Now, if you notice narrow, irregular tachycardia, it would be a atrial fibrillation. Generally, we treat it with the beta blockers. If doesn't work, we can also try antiarrhythmic drugs. And even after this both, if tachycardia doesn't settle, you can go with cardioversion. Remember, every tachycardia in the end stage, you will do cardioversion if any medication doesn't work. Now let's talk about wide complex tachycardia. In regular wide complex tachycardia, the most common example will be monomorphic VT, which we treat with the antiarrhythmic drugs. In the example of irregular wide tachycardia will be a polymorphic VT, which we treat with the antiarrhythmic drugs. If this both wide complex tachycardia doesn't settle with the antiarrhythmic drugs, we go with cardioversion.